More often than not, pain in or around the rib cage is caused by an injury, and it will heal on its own with time and rest. But there are some diseases and conditions that cause discomfort under the rib cage. These include the following. Costochondritis. Costochondritis is a relatively common cause of rib cage pain, and it may be mistaken for angina or an impending heart attack. But it's actually caused by inflammation of the cartilage that connects your ribs to your breastbone. Discomfort can range from mild to extremely distressing. Pain usually feels closer to the surface than you might experience with angina, and it gets more intense when you touch or press on the tender area. Fibromyalgia. This is a chronic condition that often affects women in 90% of cases, causing burning, throbbing, stabbing pains, or aches throughout the body. Often, fibromyalgia pain occurs in the area of the rib cage. Fibromyalgia in the chest area, like costochondritis, is often mistaken for angina caused by heart disease. Pleurisy. The pleura are thin tissues that line the wall of the chest and the lungs. Normally, they slide smoothly across one another. However, they sometimes become inflamed and rub against each other, causing significant discomfort under the ribs. Pleurisy is also called pleuritis and usually lasts from a few days to 2 weeks. It sometimes resolves on its own, but it can also be treated with antibiotics. Pulmonary embolism. A pulmonary embolism happens when an artery between the heart and lungs becomes blocked, usually by a blood clot that has traveled up from the legs. A PE, as it is often called, causes symptoms similar to a heart attack. It's a medical emergency that can cause permanent damage to the lungs or other organs due to a lack of oxygen. Cancer. Pain under the ribs is a characteristic symptom of lung cancer. Pain is sharper when you take a deep breath, cough, or laugh. Other symptoms include coughing up blood or phlegm, shortness of breath, and wheezing. There are a number of other minor causes, like small injuries, of pain under the ribs. But because of the possibility of heart problems, anytime you have a pain in your chest, you should consult a doctor for a diagnosis.